Good afternoon to everybody, dear friends, dear colleagues. We are starting the today webinar with the usual technical information sharing with you. So this webinar is streamed online on Facebook. It will be recorded and made available on the EASPD social media channels. Your microphone will be muted to ensure the quality of the session. But for the questions, please use the question and answer box. And for the comments, feel free to use the chat box. You can activate closed captioning by clicking the live transcript button on the lower part of your screen in the Zoom panel. The provided subtitles can be clicked and dragged to move the position in the meeting window. If you would like to access the captions on the separate tab, please click the link provided in the chat box. So now we can start the webinar with a very powerful title, Guaranteeing Early Childhood Intervention. And today we are going to launch the position paper, Family-Centered Early Childhood Intervention, the best start in life. It is a very strong, powerful title, but also a tool for all of us to advocate for the importance of this topic, the family-centered early childhood intervention. So first of all, I would like to introduce myself. My name is Vasilka Dimoska de Jong. I am a Secretary General for the National Association of Persons with Intellectual Disability and support of their family in North Macedonia. But also I'm a board member of the EASPD, and so I'm a few mandates. I have a pleasure and honor to be chair of the member forum on early childhood intervention. I'm very proud and happy that today we will launch this very important position paper because I was one of the initiator of establishing this member forum within the EASPD, and with the small steps today we are in the point that we have a good tool to raise this issue on the higher level on the political agenda. So actually, this position paper was drafted within the member forum on early childhood intervention, but it was finalized in consultation with several networks and organizations active in the fields of disability, of rights of children, rights of families, and we made this as a family-centered issue because it is really important. The support it is very important for the families with the children children with development delays, with born with risk, or need support in the educational or social inclusion. So today we will have opportunity to hear some presentations relating our position paper, but also we will have opportunity to discuss about this important issue, especially that we in our discussions within the member forum of early childhood intervention, we find out that the national system as well the European system on early family-centered early childhood intervention is very poor. So our aim is to make it stronger and to, as I already said, to put on the political agenda on the national level, but also, which is more important, on the European level. Now I will give a floor to Dragon Pislaru from Renew Europe.
Hello, dear colleagues, and thank you so much for attending this event, and thank you, dear EASPD, for organizing it, for publishing this very interesting position paper, and I really congratulate you on the work, and I hope that we can have a meaningful discussion today. It's an honor for me to be a part of the introduction in the works of today, and certainly the issue of early childhood care, particularly for the most vulnerable children, including those with various disabilities, can be a key for a child that grows up happy, healthy, and with access to the care that she or he needs and the opportunity to pursue a flourishing life. Giving visibility and prioritizing support to families and children with disabilities in their first years is a fundamental base to break the cycle of poverty and disadvantage. It's also a fundamental ingredient for more just and equal societies. It's also, and I say that quite often, it's also an investment that has multiple rewards for the society. And it shouldn't be seen other than an investment for the future that creates opportunity and access. The discussion today won't be only about the access to support, but also about the quality of this support. And family-centered approaches are about empowering and working with families as equal partners around their needs, which is about transforming the support and the approach from a medical charity to a human right-based one. And as you might know, I am indeed this mandate, and even as a professional, separately from my political career, I'm a very strong supporter of investing in children, in particular in early care and early education. I fought tooth and nail for the next generation pillar for children and youth in the RRF, and we have right now 40 billion euro that are right now spent across Europe for children and youth. And I was one of the co-sponsors and leading voices in the Parliament asking for and preparing the European Child Guarantee. And now I lead the working group in the Employment Committee on the Guarantee, and I'm trying to figure out how member states are indeed proposing to implement it, monitoring their national plans, and trying to move, the needle forward, including on early childhood intervention. And it's really important because the Child Guarantee has, among the targeted vulnerable groups, of course, the children with disability, and this is one of the highest priority that the European Union should have. It's really great to see the work done to launch this paper coordinating by EASPD, but that was endorsed by lots of organizations in the fields of child rights and disability. And I hope that this coalition and the coalition that future actions will be accelerated by this work and its implementation. Again, I strongly support your work, and I will try to be all the time together with you and standing by in order to be sure that I'm meeting any kind of expectation you have as the chair of Employment and Social Affairs Committee. And again, big thanks for inviting me to address you, and a lot of luck. And again, let's do things together for children that are in need with disabilities, and not only for them. Thank you very much.
Thanks a lot, Dragos. There were very nice words to hear from you, and it was nice to hear that you are supporting, and it's great what you already did until now. And I also personally hope that through this work we can make ECI more prominent in Europe and in the member states, and in particular as a follow-up for the Child Guarantee. Thanks a lot as well to Vasilka for introducing this meeting, and I introduce myself as well because I didn't do so. I am Irene Bertana, and I am the EASPD Senior Policy Officer in charge of ECI, Early Childhood Intervention and Inclusive Education, and I facilitate the work of the Member Forum on Early Childhood Intervention. That was the main promoter and drafter of this paper. So I will also chair this panel, this first panel that has the aim of giving you a better understanding of what we mean with family-centered ECI. You have because it's not only about providing support to children and families, but it's about providing quality support to them. So the first part of this position paper is about raising awareness and also create a coalition around our vision towards family-centered DCI. And I will have with me some very important persons from our member forum and from civil society. So Eric Blomkolk, who is the co-chair of the member forum, and then Daria Udovic Mamulin, I probably misread her surname, sorry, Daria, that is also a member of the member forum on ECI, and the director of Malidon, which is a center that gives family-centered ECI. And then we have Agata Dato with us from Eurochild, that is also co-coordinating the campaign First Years, First Priorities. So together with them, we will go through the main points about what we mean by quality ECI. So I would start to bring in with me Eric.
Hello, Irina.
Hello, nice to see you. So I would start with some questions to introduce you to the audience, the participants of this webinar. So can you introduce yourself to us and tell us more about your main activities around DCI?
Oh, thank you very much for this great opportunity to be in this webinar. I'm thrilled because ECI, early childhood intervention, is a big priority for my organization, Soft Tulip, and for myself personally as well, because my firstborn son was receives support from early childhood intervention in the Netherlands, and that really had a fantastic positive effect. So there's a personal motivation there too. Yeah, my involvement in ECI that started actually on a professional level in Ukraine. I started to work in Ukraine already in 2006, and I was confronted there with horrible situations in institutions for disabled children. And Soft Tulip, we decided to, from a humanitarian point of view, to try to improve situation within the system. And we succeeded in that. We had to lobby, and we trained the care workers in those institutions, in a lot of them. But obviously, we are not in favor of institutions. So right from the start, with Ukrainian context, with Ukrainian counterparts, we started to discuss how can we prevent that children get into this system, get into the baby homes, get into the internats, as they are called in Ukraine, for disabled children. So in the discussion, we started to think about, okay, prevention, okay, early childhood intervention, that could be a great option. And there it started. And from there, we organized trainings for NGO daycare services for children with disabilities, together with one existing, already existing early intervention team in Kharkiv, in the north of Ukraine. And from there, we built up a whole group of very motivated early childhood intervention centers. After a few years, we had 4, and now before the war, this war started, we had even 35 early intervention teams throughout Ukraine in 10 different regions. And it really is becoming now step-by-step part of the national system of care. And even during war now, there's a new law in preparation on early intervention. And as well, I worked on the same theme and with the same method in Moldova. And to some extent, we also provided trainings in Bulgaria and Czech Republic. So I have a broader view on what is happening in the different countries in Central and Eastern Europe.
That's really great to hear what you are doing and where it starts from. And I think you are really the best person to be here to talk to us about this position paper. But first, I would also like, as you are also the co-chair of the member forum on ECI, to tell us a bit more about the role and the history of the ECI member forum of EASPD.
Yeah, that's also for me personally very interesting story, because when I became active member of EASPD in 2011, if my memory is correct, I experienced that there was no attention for early childhood intervention at EASPD at that time. There were thematic working groups, but not on ECI. So I started to lobby that there would become at that time it was called interest group on early childhood intervention, and could find some other organizations, members of EASPD interested in that theme. And in 2014, we could start already with an interest group on early intervention. And for example, that already had the result that in 2016, during a conference in Moldova, early childhood intervention was an important subject on the agenda of that conference, and we published already there not the position paper, it was called statement. Oh yeah, EASPD statement on ECI. So that was 2016, but in 2019, 2020, EASPD started to reform these thematic theme groups, and took the decision to start a member forum of early childhood intervention. And from there, it really took off. I think, if I'm not wrong, we have more than 40 members now from all over Europe.
More than 50.
That share their knowledge. We organize trainings. We give follow-up to EU policies. And now, as a new initiative, this position paper. But this position paper actually, first there was the launch this year, beginning of this year, of the Balkan report. We did a systematic analysis of the situation in 5 Balkan countries, Albania, Greece, Kosovo, Montenegro, and North Macedonia. And we did an analysis of the situation of the system of ECI in those countries. And the results were very much in line with my already existing experiences in Moldova, in Ukraine, Bulgaria, pointing out that ECI was still, in most of the countries, run by NGO, non-governmental organizations, pioneers. That there was no integration in national health or social care system. That there were no quality standards formulated, quality standards for procedures, the ECI procedures, or education of professionals, or the assessment of the children. And so there are hardly any national regulations. And last but not least, hardly any official financing for ECI services. So these findings actually formed the basis of the position paper that we are launching today. And Vasilka already mentioned it, we detected the big need on national level, but also on regional level, like in Balkan region, and on the European level, to create awareness and to put ECI high on the agenda of the policymakers, so that ECI would be supported strongly also from EU side. And this you can't do alone. So it's fantastic that today we are together with so many European networks on disabilities, child rights organizations, and family networks. So I think that's a big achievement of our member forum now.
Yeah. And thanks for this very comprehensive history. And thanks to you for pushing for it and for having a very active role in this.
That's my pleasure.
I think that you are also the best person to start by giving us a bit more of context and of definition. So can you give us a bit of information about what we mean by ECI and quality ECI?
Yes, of course. And I've prepared a few slides, only 4.
And which I will share for you.
If you will share
soon
that,
as I manage. Okay. I
Okay.
think you can see.
That's great. One moment, please. So what is ECI? That's a big question, of course. And in the policy paper or the position paper, we opted for not giving a very short definition, because actually ECI is too rich to capture in just in a few sentences. So first of all, ECI promotes the development of very young children disadvantaged by biological or environmental risk factors. What do we mean with very young children? It differs between countries. In some European countries, ECI is about children in the age group of 0 to 3, and others in the age group of 0 to 6, and even some countries are to a little bit older age. And what do we mean with biological or environmental risk factors? Well, the biological factors can be like premature children, children with disabilities, children with developmental delays, but also families with complex psychosocial and economical problems. ECI aims at social inclusion and well-being for the family and child. So it's not exclusively focusing on the child. No, it sees the child as integrated in the family and can only prosper in a healthy, good family environment. ECI prevents and reduces, and even sometimes it's possible to eliminate disabling effects. ECI also promotes the school readiness. That's why it's so important to start as young as possible. And ECI is a system of transdisciplinary coordinated services for family and other caretakers. It takes place in the natural environment of the child. And what do we mean with natural environment? It's an environment where the child grows up. So it's at home. Can be at the playground. It can be in the supermarket. It can be in a kindergarten. It can be in preschool settings. And it promotes very much the positive self-image and learning dispositions of parents and other caretakers. So ECI actually is about empowerment. Empowerment of the parents, empowerment of caretakers who will be empowered, who will have the capacities to support the child in the best possible way. Next slide, please, Irene. So to get a clear picture of what ECI is, it is good to make a comparison with the classic care model, where the child is treated by mostly medical professionals or paramedical professionals like pediatrician, neurologist, manual therapist, physical therapist. And they work with the child in the classic care model. It's a more medical approach. And the parents are more or less not in the picture. Parents may raise some questions, may get some tips from the specialist. And the specialists do not work as a team. Next slide, please, Irene. As you can see, early childhood intervention model on the right side on your screen. Actually, there's one team, and that's the family, including the child, father, mother, grandparents, siblings, other community members. and ECI professionals. Mostly early intervention team consists of a speech therapist, physical therapist, psychologist, pediatrician, social workers. Depends a little bit on the specific situation. But as you can see there, family and ECI are equal, ECI professionals are equal partners in the work that is provided. Parents do play a very active role, and actually the crucial role in this model. Then the last slide, please, Irene.
This was
So,
the last slide. I mean,
the last
yes.
slide?
Yeah.
Yes.
Can you see it?
Yes.
And just please be very short because we are
I'll be very
running
short.
out of
I'll
time.
be very short. I'll be very short. So quality ECI services need to be early and continuous. That's quite obvious. It starts to work with children shortly after birth or as early as possible. One moment. It is family-centered. The family is absolutely in the core of all attention. They are equal partners in planning and implementation of the services. Quality ECI services are based on the social model of disability. So rather than addressing solely a child's areas of need, ECI also focuses on assessing the family's strengths and well-being. Quality ECI services are intensive. Support actions can be frequent, depending on the needs of the child and the family. They are accessible. ECI services must be easily accessible to all, affordable for all families, and the service should be based as close as possible to the family's homes. They should be transdisciplinary, integrated, and team-based. They should be individualized and evidence-based, and they should be based on the best interest and participation of the child. So, quality ECI requires close relations between ECI team and family. The intervention should take place as much as possible in the natural environment of the child and the families. And family needs and priorities are the basis for the support. Families and caretakers are empowered to be able to support the development of the child in the best possible way. That's it, Irena.
Thank you.
I had to be short.
Thanks a lot. It was very good. And yeah, well, thanks for all you did about ECI. And now I would move to the next speaker in order not to run out of time. So Daria, welcome.
Hi.
There you are, there you are. So you come from Croatia when you direct a service that does family-centered ECI. Can you tell us shortly about the history of Malidom?
Okay, thank you, Irena. Yes, I was a long-time director of Malidom, not anymore, but I'm still connected and doing the also working for organization that supports ECI along in Europe in other countries as well. But Malidom was really the first in Croatia and one of the first in the Balkan region to have ECI. We started 25 years ago, and I will not be long about it, but I think it is just shortly to say how we did it, because it might be very useful. So we really did try with not facing various problems such as lack of legal frameworks, identification of key principles, increasing needs that were happening, parents that were, changing, asking for support, uncoordinated services. So like 10 years ago, together with UNICEF, we implemented the project, which main task was to create a model that would be comprehensive and accessible and applicable. And actually, the outcome of that model would be a model that would be possible to scale up, but also that was a way to gather not only the experts from all other disciplines like health and education, but also key stakeholders. So people from the ministries, from the education, health, and social welfare, which are crucial for the ECI services. And not only that, we managed to establish methodology and model that we later scaled up, but also that the outcome was, which was very important and prerequisite for development in the whole country, was that actually the direct result was that it entered into legal framework. So the outcome was that around the table, between themselves, representatives from the government really agreed that we should put ECI in the legal framework. It was decided it would be social welfare, but that was really basic prerequisite that it could scale up, that other organizations can start doing it, and that they could get support. Not enough and a lot of problems, but still without it, it wouldn't be possible. So, yeah.
Thanks a lot for this overview. And then now I would go to the content. So can you tell us why it is so important to intervene early with children at risk of developmental delays and other issues?
Yeah, I will share screen. That was from the colleague Agapi, who is also a member of the ECI group.
Yeah, and just to say, I totally forgot to mention it. I would like to thank Agapi for all the work she did. She has COVID, so she was supposed to be here with us. She's here with us, but not speaking because her condition don't allow it. Yeah, so you can go ahead.
Sure. So these are from Agapi's slides. So I will, instead of her. So why is it important? It is crucial to start really early with early intervention, because it is more effective when it's provided earlier than later. And of course, we all know neuroplasticity of the brain is the crucial part. And that's why we always say 0 to 3, because that is the age when actual neuroplasticity is at its best. So after 3 to 6, there are some other approaches and methodologies we could use in early childhood intervention. But first years are really based on that. So not only when to know how, but also to know when to implement it. So time factor, when and how. So how, it's learning in early childhood, learning in natural environments, routine-based learning throughout the year, and concept of important adult care. But we will talk a bit about it later. So now I will focus about as earlier as it is possible. And in fact, already in some countries, you have early childhood intervention in hospital settings already, which would be the best place to start if we already know that there is an issue there, and that we can all support parents and children already in the hospital area. But after that, also as soon as you get, because neuroplasticity has to do with the ability to change through experience and at cellular, metabolic, and anatomical level. So together, it really shapes the quality of brain architecture. And we know as well that it's scientifically proven that there are periods, time windows, as we call them, when certain, with appropriate stimulation, with quality of early experiences and amount of positive stimulation, we can really make neural circuits, so those connections in the brain, grow. So not only as we can do from 0 to 3 and even later in life and through all our life, to make them stimulate that their neural circuits go and overcome obstacles or damaged area or problematic area and go around it or take their role, but there are time windows very early. So and for each area of development, that we can actually grow completely new neural circuits in a much more much more amount that would really help and make a very positive result. Like, for example, for vision, it's, I think, first 0 to 3, for motoric development, 0 to 6 months, for cognitive area, it's all first year. Maybe I did some mistakes, but that is very important that we know that there is a time window for each area of development. If we really provide enough stimulus for that, there will be certainly very, very positive response, and we can, and that is why that is very important. So this is something of then, because each brain function has its own critical development time, which we call time windows. But also there is as well, we know, and it's scientifically proved, that, as we said, quality of early experience, amount of positive stimulation, but also appropriate responsive care of close adults very much affect the brain development. And all the neurobiological data support that impact of the environment. So we can consider that early childhood intervention is to improve the natural environment of the child in an early stage. And really, there is a lot of scientific data. There is a lot of best practice data. So as soon as we can start. So not only, so I concentrated mostly of children and brain development, but also we should not forget why timely intervention is very important for the parents as well, because that moment when they find out, could be before or could be after birth, that there are some issues. There is a whole process that starts, and everybody who knows a bit about it knows the stages the parents can go through, have to go through, and the support is crucial, because, as we said, also appropriate responsive care of close adults is really something that we really need to think about as well. So that is about timely response.
Thanks.
Yeah.
Just to comment on what you said, I really think that when we see disability as the interaction between the impairment and the environment working on the parents who are part of the social environment is really something that then can have, in this sense, an impact on the disabling effect of the impairments that a child might have. And I would ask you, again, very, 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 very briefly, to say a few words, although Eric introduced it, about the family-centered element of
Yeah, also, I would just like to go back, because I didn't get one sentence that Agapi put there, which I think is important. Sorry. We know nowadays that neglect is one of the things that really affects child's development. But we could not say that only neglect, that we do not address their needs. But if we don't work with families and parents, not knowing what their needs are because they're not supported by professional, can result in neglect. So they neglect their needs because they do not know how to recognize their needs. And that is also very, very important part when we work with families. So
yes,
okay.
Yes, it was worth saying that as well.
Okay, so I'll just share. I will really go quickly. I know that Eric did say a lot, but I will still just share quickly. Just a few slides, and that could be.
Now we see your deck. So.
Yeah.
Okay, now yes.
Again, the same one.
In the other one,
yeah. Hopefully, this one. Okay. So
yes.
I will really be shortly. So what is family-centered? It describes the method of coordinating and providing services to child and the family. It's based upon family's unique strengths and needs. And what is important, it's focused on the outcomes for a child and not on services. And I like to think of that is the way of thinking and acting, actually, of professionals, because the professionals across disciplines, as we said, there are a lot of disciplines involved, especially in early childhood interventions, have to share the same sets of values, skills, behaviors, and knowledge that recognizes the central role of families in children's lives. So professionals need to identify what strategies and experiences will work for the particular child in the particular family circumstances, and then to work with the family to build those into daily routines. I'm really going fast, so I'll just maybe key points. So model focused on the family, we heard what Eric said, and that is absolutely, I will not repeat, but I will just maybe say a bit more why. More services, like we have fragmented services and specialized services in a lot of places. That does not necessarily mean better. Rather, the services achieved through prior cooperation with experts from different fields, coordination, and then transdisciplinary approach in a way that integrates into unique activities, which will be presented by one key worker and embedded in everyday family routines. Really, they do make a lot of change. First, child learns through routines. It learns best in their natural environment. And then also families and parents, it reduces likelihood of confusion by reducing the number of people and disciplines they interact with. And this model is much less intrusive into the family routine, into their family life, because parents need to build one or few key relationship and build trust. And then it's enhanced and streamlined communication. It's a key benefit for the family as well. And we have to know that there is no discipline that is more important. So we really have to embed all into one of that. So we do include families in everything. So from assessment to planning and intervention itself, it has to be focused on establishing natural environments that provide context for everyday activities. Of course, that's what we said. And just trying we will finish it because I know we are out of time, but then children learn and develop best through everyday play and interaction with parents, carers, and families. And when you help families build skills, knowledge, and confidence, you also help to create that best environment. So yeah, I think.
Thanks a lot, Daria. I think that you did pass the correct message, and thanks again for your clarity and for your work and commitment. And now we'll quickly go to Agatha. So Agatha from Eurochild and also responsible for the campaign First Years for First Priorities, can welcome with us. And can you tell us a bit more about this campaign?
Of course, thank you, Irene. Yes, let me share just a couple of slides to introduce the First Year's First Priority campaign. So this campaign is a Europe-wide campaign on early childhood development that Eurochild and ESA, the International Step-by-Step Association, together with other associate partners, established in 2020. And with civil society partners across Europe, we are advocating for the EU and its member states to increase attention to and public investment in early childhood. The campaign focuses on children who are most vulnerable, including children with disability. And our special attention is on the first 1,000 days of life. And what's important is that the whole First Year's First Priority campaign is really envisaged to feed the narrative around a much more holistic and comprehensive understanding of early childhood development and how it integrates into the fight against poverty and promoting equal opportunities for families and children. And the First Year's First Priority runs in 10 countries across Europe, and it's implemented by 10 national organizations who are coordinated efforts at national level. And what we are really trying to do is to fostering a mutually reinforcing dynamic between EU and national level policymaking. And here it's a little announcement about our forthcoming event on the 29th of November for those who are interested to attend.
I was muted. So thanks a lot. It was very interesting, and I really hope that we will be able to join forces because there is a lot of overlapping between our vision and what we aim to do. So it would be great for us to help you in this effort and mutually reinforce each other. I have it was two questions, but they would be merged in one. So the question is why ECI contributes to make better society, and can you stress the link as well between ECI and the institutionalization, so the transition from institutional to community-based care?
Yes, absolutely. About the link between ECI and making better societies, making more equal societies. Of course, the link is very strong. As Eurochild, we know the need to sustain quality services that reach the most vulnerable children and families. We know the importance of ensuring better integration of services and ensuring an enabling policy framework that reflects the needs of all children and families. Investing early in nurturing care for all children, including those that need special support to enhance their personal development, it's essential for their healthy development, but also for the well-being of society and for countries' prosperity. Public investment in early childhood is one of the most visionary and effective policy measures that government can take. It's only through the inclusion and support of children from the youngest age in their family and community that they will be able to participate in society, be included at school, enter the open labor market, and enjoy basically the full range of their human rights. This is where public investment can make the greatest difference. Young children are entirely reliant on adults for their care. Children's development depends largely on how parents and caregivers interact with them and respond to their needs. But young children well-being is far from being only a private matter. Governments have a critical role in supporting parents and families, but also in creating an ecosystem of policies and services empowering young children and their families. So that there's really a great need for a Europe-wide coordinated effort to bring increased political attention to invest in early childhood policy and services as a means to reduce inequality and promote inclusion. And we really need to invest in early childhood intervention services if we are to build inclusive and resilient societies. As far as the link between ECI and the transition from institutional to community-based care is concerned, the provision of early childhood intervention services and other support services for children with special need has a significant impact on a child's ability to learn new skills, overcome challenges, and reach their full potential. The aim of these services is to empower families and male caregivers in creating an environment that supports their children's development, acquisition of competencies during their first years of lives. And with this adequate support and community-based services, parents and caregivers can really provide the best sustainable and affordable support for their children, who can develop and flourish in a family environment rather than being separated from their biological families and placed into institutional care. Vulnerable children, such as children with disabilities, often experience discrimination and are placed in segregated, specialized school settings, including boarding school settings, because local public schools do not accept them or are not qualified to support their needs. Lack of support to families and inclusive education, including inclusive ECEC in the local area, are the main reasons for pushing children with disabilities into institutions. So it's really important to invest in early childhood intervention services, also to prevent DI and to foster community-based services. In some European countries, for example, Croatia, Czech Republic, Greece, there are still very young children, 0 to 3, placed in institutions, and we know that a lot of evidence saying that institutional care is particularly harmful for very young children. It negatively affects their mental and physical development. But there, the issue of data is also important, and I want to raise this last point. As found out by the Data Care Project run by Eurochild and UNICEF ICARO, published data on children in alternative care often do not allow for disaggregated information on children aged 0-3, which is exactly the group of children for whom the harmful impact of institutional care has been shown to be much greater than for older children. So it's important really to be able to see in the data whether children aged between 0 and 3 are accommodated in institutional settings or not.
Thanks a lot, Agata. It was really very comprehensive and to the point. Now I will very quickly move to Maya, because we have Katrin Langensippen with us for the next 9 minutes, then she needs to leave. But thanks a lot to all the panelists for the first panel, and we have some questions that maybe we can come back to them later. And Maya, to you.
Thank you, Irene. Thanks to all of the interventions from the first part of the event. You know, listening to all of you is making me really happy that we're on the same page, first of all, on the values of ECI, and second of all, on the importance of ECI. Now, in this next part of today's webinar, we'll actually have the policymakers' opinions on how the EU and the ECI connect as topics, and I think that that's also a very important part of the conversation. So today with us we have Katrin Langensippen and then Stelios Kympouropoulos. I'm very sorry, I'm sure I'm not pronouncing your name correctly, Stelios, and Dragos Pislaru, which we also had an intervention in the first part, respectfully from the Greens, EPP and Renew Europe. And for us it's really important to know how policymakers see ECI and the relation between the EU, the EU's agenda, and ECI. So, Katrin, I would like to start with you. You're very active when it comes to promoting disability rights, and I would really like to hear your point of view when it comes to family support and the importance of family support being on time when it comes to disability and human rights.
Yeah, thank you. Thanks for the invitation and raising that important topic for families with disabled children. As you know, I'm traveling around the European Union and visiting several member states, and I was in Poland, and here I want to give an example. Here we have the mothers, so the role of the mothers, and when we are talking about families, we have a huge impact of the power of the role of the, how you ever want to call it, of women when it comes to taking care of their children. And the children are mostly 50 or 60 years old. And I met mothers in Poland, and they told me that it's forbidden by law, for example, if I have to take care of my child, I'm not allowed to work. And if I, maybe I'm a freelancer and I have the opportunity to do part-time, I'm not allowed to work. So we keep here women from a feminist perspective into poverty. And that is an issue, a situation, what is unacceptable in the EU when we are talking about equality, that we put women, younger family into poverty, or for example, the older brother is taking care of his or her disabled brother or sister. That is still that we have the focus on disabled family or family with disabled children. Here I listened very carefully to the intervention here started before, and I haven't heard, but please correct me, the role of the institutions. we have and Germany is unfortunately here on the forefront when it comes to institutions, that we put persons with disabilities or children with disabilities institutions. And when I was in Poland, the mothers told me, I don't want to bring my child in a Christian institution, for example. So what about independent living? What happened to our children when I'm not there anymore? And me, as a disabled person, when I'm 15, 16 and older, I don't want to get mothered by my mom. Why should I? Here are non-disabled persons in the room. Imagine your mom is feeding you when you're 16. Who wants to see that? Who wants to bear that? So please, we need to come away from that persons with disabilities are helpless and we have to take care. We are talking about independent living. And here I come to an end for that question is, what about personal assistance? How can we make it easier to bring independent living and personal assistance to families to make them independent?
Thank you very much for making the link between ECI and independent living, because I think that's one of the strongest points when we discuss the importance of funding. And thank you very much also for underlying, of course, the families have the main responsibility to take care of their child, but that should not mean isolation from everything else. And I think that the role of institutions, and then I will also go towards my second question. I can tell you, as somebody who worked in an ECI service for a couple of years, how, for example, I would see the role of institution directly with funding. I have to be very honest. The experts already found the best way of early support. And what I'm missing a lot of the times, and what also Eric underlined in the beginning, a lot of the countries are skipping the topic when it comes to funding. They're very supportive when it comes to, yes, of course, this is the right way to do it. So my question is, how do you think the European Parliament can enforce how institutions, and what's the role of institutions when it comes to ECI? You're muted.
Now, yeah, you can hear me. I saw one simple question in the chat. I'm from Germany. I'm a German MEP and I'm a person with disabilities in the European Parliament. And I grew up in a regular school. And of course, the question is, how can I survive in the daily life? So education, we need inclusive education, inclusive labor market, and phasing out institution. And I see my dear colleague Dragos here he's waving. And here we have a clear political position, phasing out institutions, because, and we saw it in the COVID times, they are kind of a locked, kind of a prison. You are there, no one is controlling the situation. You have no information of how can I get out. Parents are more or less under pressure, morally under pressure, like you want to do all the best for your child, so bring them in an institution. And that's what I get from Germany. So our position is, of course, phasing out institution, and then we are talking about money. What about ESF funds? We are the major experts of funding. And when it comes here to how can we support human rights, we have to or support our member states. And we have, maybe Germany is a rich country. We have different countries, different member states. They are not that under funding. And still, but apart from funding, is still that belief persons with disabilities need to be protected. And that is the wording I only know from Germany. We need to support the protective areas or protective institutions. Sorry, no persons with disabilities want to be protective. Protected from who? And that shows a picture of, oh, the white man without disability is a dangerous person. No, my colleagues without disability are not dangerous. They're colleagues, they are allies. And I saw many, many allies in the European Parliament. So please stop drawing that picture. And we are talking about we here inside and they are outside. So we are talking about wording. We are talking about power sharing. And of course, and that is what I'm calling on the Commission, we need money, funding, ESF, EFRE fund, when it comes to independent living. And we have to bring it on the top. And here I call on Madame Metsola. She promised me to push the UN CRPD on the forefront. So when we are talking about human rights, citizens' rights, then we are talking about independent living for persons with disabilities, their families, and persons with disabilities in general.
Thank you. We always rely on your passion for this topic and for all of the other topics that we collaborate together. And I really hope that your message is loud enough to be heard, because without funding, you cannot do quality ECI. And without quality ECI, what you end up is more institutions and more unsupported families. Because I think the main thing, we don't need protection, but we need support. Protection is a very restrictive, unwanted thing to happen to you. And support is on the contrary. Support means community, and support means shared. So thank you very much for your time. I know that you have to leave, and I really appreciate that you are together with us. We will bother you again with the policy paper, and we hope
that is very good. Bother me all the time.
We do trust, and we do rely on you for being vocal about it as well. Thank you for being with us today. I would now like to go a bit more to the policy paper, the reason why we are doing this event today, and I will go to our MEPs in a second. Irene, can I ask you briefly to go, what are the recommendations that we have? Because as I said in the first part, I think we're very clear what we stand for, what kind of values we want, what kind of specificities and characteristics there are in ECI. But what are the recommendations that we have landed on with this policy paper?
So I will, as quickly as possible, share with you some slides about the recommendation. You find a part in the position paper about challenges and solutions. You also have national solutions, but today, since we are talking with MEPs, we had to make a choice. We are focusing on the solution for the European Union. So the first big challenge is about the fact that policymakers don't know what quality ECI is. And so our proposal as a EU solution is about developing EU guidelines on ECI systems for both member states and accession countries to consider a mainstream in the fields of child rights, family rights, disability rights, and deinstitutionalization. Second part is that there is lack of data about the state of play of the existing ECI services and the quality ECI services in between them. So it would be very important for the EU, although the agency on inclusive education and special needs education did a research like this in 2013. So there is something to start with, but it would be great to have a EU-wide study on ECI in terms of policies and practices as well. Then for what concerns the legal frameworks and funding, we have multiple challenges, and they were already mentioned before. So, but this one not, for example, the assessment instrument make really a difference in all the following steps, and we need reliable instruments for this. So then we have a lack of personnel standards. So it is important, of course, that there are shared values. There is a certain quality in the staff, and this is lacking as well. And then there is a lack of mechanism for supervision, monitoring, evaluation, impact measure, so all the elements that ensure the quality of the services. And then families can access to quality ECI services depending on where they live, basically. If they are lucky enough to have some services of quality and done in a certain way, but if they are also coming from isolated areas or coming from also because it's not necessarily for free that these services are given. So there are a lot of barriers to the access, to the equal access to ECI. And so for us, the recommendation to the EU about this are about using instruments such as, for example, the technical support instrument to implement reforms on ECI. We are doing a technical assistance in Greece now to develop a reform on ECI, and it is really, of course, making a difference, hopefully, in the future of the country. Then foster the exchange of information and experience on ECI among national ministry and the relevant stakeholders. And include recommendating ECI strategic plans as a part of EU initiative on children, disability and care. So basically mainstream ECI in the different initiatives and monitoring such as the European semester. So I mean country-specific recommendation on ECI, and also the actions that are following the strategy on the rights of persons with disability, the child guarantee with the national action plan and the EU and the long-term care recommendation should include ECI. And then having on the European level, EU monitoring and evaluation of ECI, for example, with the instruments that will be created for monitoring the European Child Guarantee and also the European semester. The last element is about the training and the working condition. So the working, of course, the staff makes the quality. So if there are poor working conditions, the quality of ECI can for sure be impacted. And also there is a lack of public training service system for professional and university programs to create people, I mean, not create the people, but create a curriculum for people to work in ECI. And here the EU can do a lot as well. For example, by creating a platform for ECI trainings with instruments that are kind of assessed, maybe working with university and having them in all European languages. This can increase the standard for trainings. Support the development and implementation of national ECI training plans, and fund the sharing of good practices through, for example, exchanging, visit, conferences, international study tours to best practices, and scientific research on ECI through programs that are like the Erasmus Plus and Horizon Europe. And I am done with it. Thanks a lot.
Very efficient, very straight to the point. I must say, before going to our next two speakers, that I really want to thank everybody in the member for working on that. But also, you know, when there is a lot of input from a lot of knowledgeable people, there always has to be somebody who piles it up and designs and delivers it. And Irene, thank you very much for working on the policy papers, because I know that you spend a lot of time, and I'm sure that the result of this document will be worth it. So thank you very much. I would like now to go and explore a bit with our next two speakers how do you see these recommendations in reality? Because I think that sometimes in civil society we are very strong in recommending, and sometimes, unfortunately, we don't see our recommends being heard in the right way that we hope. So I would like to go with Dragos and just very bluntly ask, what do you think, from what Irene just pointed out, is the most important recommendation? How do you read it?
First of all, hello again for those that have entered meanwhile and have not caught me at the opening. Thank you very much for the excellent and very comprehensive way of summarizing the conclusions recommendation. I had a lot of notes already. I went to the text, but this PowerPoint was really well arranged. Now, there are a couple of things that I think that they are easier to obtain. I will start in an order which is not necessarily the best prioritization. The TSI, Technical Support Instrument, I was a rapporteur on it, and indeed, it's not that well known. I mean, we should try to push the member states to use it. It's a source of expertise, and also when I was negotiating, there is another thing that I've asked. I asked for opening a library with all the studies and the analysis that the TSI is doing in other member states. So it's a very good collection of best practices, because one of the recommendations was about sharing. So for instance, if there is a work done on Greece, before in the previous financial period or the previous version of the TSI, it was not very clear that you can actually access the information. And I ask this time in the regulation to be sure that we can have access to it. Now, it's still a process, but there is a library there, and I think that we should inspire from that. That's about exchange of info. Lack of data, that's a major problem indeed. Here, I'm actually trying to work with whom I can as a chair of the Employment and Social Affairs Committee. We do have our own Department of Research in the European Parliament, and I need to confess that when I was hearing about the fact that we need more research about the challenges that are in the ECI field, I was tempted also to propose to my colleagues in the Employment and Social Affairs Committee to ask the EPRS, the European Parliament Research Service, to have a policy outline maybe that can help us. So so that can be another thing that I can even, more or less tentatively promise you to follow up. The other thing is, in terms of data, that we are actually gaining some traction. In the RRF negotiation, we got the social scoreboard. We've pushed a little bit more on the European semester to have the social scoreboard of the semester as well. So we need to go little by little, step by step, in order to have the entire, social realm, including when it comes to ECI, better disaggregated in terms of data, because we have general data, but we need disaggregation. I think that's actually one of the most important part. My experience as a minister has taught me that despite any kind of attempts to be very Cartesian and to try to put things in little boxes, I mean, there are so many differences among the different types of challenges that children are confronted with. So it's very important to have that data gathered and try to be as comprehensive as possible in its collection. So this is an exercise not only with Eurostat, but also in relation with DG Employment, Eurofund, and any other organization that it can help. And that's, by the way, something that I'm already doing for the Child Guarantee with Eurofund. I managed to set up a liaison with Eurofund in terms of them monitoring the Child Guarantee. And right now, the Commission, as a result of the work of the working group on the Child Guarantee European Parliament, they are ready to hire someone that can actually be only on monitoring. So that's really a great news for me. I just wanted to see materialize, but there's great news from the Commission on that one. Of course, one thing is to monitor the guarantee, another thing is to monitor a segment and then a sub-segment and so on. But I think that we can work out a couple of things there. Now, in terms of the guidelines, indeed, this is, I think, one of the most important points. I know that in the last years, I mean, I'm talking about the last 6 years, just to be more precise, I had an array of debates on DI, on the institutionalization, for instance. Shall we put all the kids in families? Shall we have family houses? Shall we, can we work out with an intermediary solution, or because we don't have the complete solution? So right now, I'm looking at several member states and their intervention on the European Social Fund Plus, and I can see an array of interventions, and I can see a lot of solutions developed by the civil society on DI. But indeed, I think that we need these kind of guidelines. I mean, we need to understand what's the final goal, what are the solutions, what's the pros and cons for them, because I have the feeling that money are not, I mean, you had the previous discussion on the fact that we don't have money, but on the other hand, there might be another thing, that money are not spent efficiently. So I'm bringing another thing on the table, that maybe some of the policies of the member states need to be adjusted to have a more efficient use of the money, instead of just pouring some money for, exactly as you mentioned, protection. So the whole point would be how we can increase let's say the effectiveness of the services to have as many children and as many children with access and opportunity that will not keep them dependent on the system in some sort of a Stockholm syndrome where we are really dependent on the system that is taking them hostages because you don't have the ways for them to get out of that. Last but not least, I would like to underline this idea to access to availability and affordability of services. I think that this is one of the most important thing. By the way, when it comes to services, we are here talking about integrated services. So it's not just one type of service, it's an array of services, and it has a lot to do with local authorities as well. So here, I think that to some extent, the work that is being done recently on the European care deal, and with the accent put on carers and the care, I mean, that's something that can actually be helpful. And just one more thing to add, because you were talking about money, and I just want to add another category which is really important to make also the connection with my first intervention when I was talking about investment. In my view, I think that we should look a little bit more towards the investment component in technologies, in assistive technologies, digitalization, and the way in which we can have technology as our ally. And for that, I know a lot of private companies in the technology field that are doing really wonders, and that are really eager to become partners and to work with public services and public procurement to try to get as many children, as many persons with disabilities, generally speaking, out of their dependence on the society, and to be captive in their situation. So I just want to say that for children, this is even more important. And I think that here it's not just about social services, it's also about health insurance and the way which we reimburse that. And for me, that's one of the priorities. I'm not in the ENVI committee to deal directly with health issues, but the idea of assistive technologies and the fact that you may get basically those children back in the society and integrate them almost completely, or depending on the case. I mean, that's something very meaningful to me, and I think that we are neglecting that from time to time. And I know quite a lot of member states that they have limited funding for assistive technologies, whereas you can really recuperate or reintegrate completely someone in the society on that one. So these are a couple of ideas based on the presentation that I heard, but I'm sure that Stelios knows by far more than I do. So I'm looking forward to hear his intervention as well. Thank you.
Thank you very much. You touched upon several very interesting and important things, how the child guarantee works with the ECI topic, how we need data in order to take decisions for the long term, and not just think of today, do we have another family house or another institution? I think that we are missing some data and some research on certain topics. But the topic of institutions and children, there is so much data on that. There is no one research that even relevantly suggests that a child in an institution has a healthier childhood than a child in a family. So I think that it's really important to have a very clear direction of how we're spending public money, and that we should not spend public money on institutions and children, because that's just a really bad idea, not only financially, but from a human point of view, from a social point of view, from any point of view that you could think of. Thank you very much for your interventions, both of your interventions, and it's always interesting to have you as a speaker. And now, Stelios, I will try again. Stelios Kympouropoulos, is it at least close to how I should propose it?
It's quite close, Kympouropoulos.
Okay. Look, I will practice for next time a bit more.
Stelios, you can call me Stelios. It's fine.
Thank you, Stelios, for being with us. I would like, again, to maybe start with the same question that I asked your colleague Dragos just a second ago, but what do you see as the most important recommendations from the one that Irene proposed and that are in our policy paper?
First of all, I would like to thank you for inviting me, and that you give me the opportunity to share some ideas with you, and having this debate on this crucial issue of ECI and the recommendations that you have proposed. I think that we have heard a lot of things, both from Katrin, also from Dragos. about what is the future and what we need for the society of disabled persons. As you know, I'm also a disabled person living, and I was born in a society back to 1985 where there were no so many services and support in the society and in my family. I finally understand that we need to create something. I don't know what exactly is this something, services I mean, which are not which don't lead to segregated disabled persons. And I want to go to another example of this, and you will see how I made this connection. I want to talk about newborn screening. Let's say that we have newborn screening and it's implemented, but we have the early screening, and we know that there is a permanent impairment. But after that, there will be the possibility of abandonment and the sterilization of an infant, because we don't have agree as society where we want to invest our money, where we want to go, where we want to lead, which direction we want to pave. So I think it's a structural issue. Before the services, before the funding, before everything that we have discussed today, is to understand and to have an open discussion where we want to see the disabled persons. And I think this is a very, very structural, because yes, we have the tools, as Dragos mentioned, but unfortunately, in member states, early childhood intervention services are only available to structures and run outside the family. All services that are designed for a particular group of children without taking into account each family. So the segregation is there, and the disabled children very often are segregated. So I think that this is the first discussion, that we need to understand that when we talk about independent living, it means that someone has the will, has the opportunity, has the elements, has the services in order to combine them and to have the life that he or she wants. We are the phase that we need to understand that society needs to adapt in the person and not the person in the society. So it's a very crucial, and I think that if I bring something new in our discussion, it would be to have a peer support, a peer support movement. Mm-hmm. Parents are always looking for informal support, information, and advice by other parents who have faced similar obstacles. At least when it comes to disability, they need to know the next steps in the growing of a disabled child, and what some other parents would do differently if they had the chance to turn back time. They even need advice from adult or teenagers, disabled persons themselves, that used to be disabled children. So I think that it's very crucial, alongside with your recommendations, to raise the issue of how the families or individuals support each other.
Thank you very much for this. You know, that reminds me a lot of when I was talking to the parents and to the children that I was working with in my previous job in the ECI service in Bulgaria. The one thing that a lot of families shared was that it doesn't matter how good the ECI service is if everything else in society doesn't work. Because yes, in your center, we have this multidisciplinary team. There is a physiotherapist, a speech therapist. They go to the playground. It's not the medical approach. It's everything that you want. But then that it's just that. The 99% of everything else are not welcoming to a child with disability, are not supportive. They're not employment models to support the family.
As we all know, disabled issue is societal issue. So we need to change and reconstruct the society in order to be there, to be for everyone. We need to reconsider the meaning of society in order to be for everyone.
Thank you. Well, I think that that's a great closing sentence of the content part of today. I would really be happy if both Stelios and Dragos and Katrin adopt the policy paper as one of your babies that you want to promote within the parliament, because, you know, we need all of the EP visibility that we can. And I mean, I'm gonna explore the fact that you're here. So Stelios and Dragos, are you going to sign our petition when it comes to ECI? Are you going to be on board with it?
I mean, I wouldn't have been here, I mean, without having in mind to sign the petition. So just let my cabinet know and I will certainly comply. I mean, no problem.
Perfect. Stelios, do we rely on your signature?
Yes, definitely. You know that every time that a petition is coming in parliament, creates raise visibility, especially when it comes to underrepresented social groups like disabled children or children living in disadvantaged family and environments. I'm a full member of petitions committee, so I will be there to support it and to see what else we can bring in the discussion after the petition we implement. It comes to the parliament.
Thank you. Thank you. That is really great to hear. And I hope that this document becomes a tool and not just a document that sits on somebody's office or on somebody's desktop, because it is a lot of work that our members put into it. And I'm very glad and grateful that it's a finished product today. Having said all that, I would like now to give the floor to Vasilka. So we go back from where we started, and thank you very much for being with us today.
Thank you, Maya. Maybe we are running out of time today, but it is not over. I'm very happy and emotional that we had a very fruitful discussion and presentation of our joint position paper. But first of all, I would like to thank to all the speakers, to the MEPs who participate, give a contribution to this very important process of launching of the position paper. Maybe it is a small step, but we are in the good direction to produce great results. So, as I said, it is not over. The document is open to endorsement of the European and international networks, organizations, and individuals. I think it will be shared on the EASPD website and also on the social media. So you are very welcome to put on the higher level this document to support and to endorse. And as I said, it is a one step, maybe small step, but we are opening one a new level to discuss and to do something more on this issue, to raise awareness, to advocate. So I know that next year will be very busy on this field, on the field of family-centered and early childhood intervention, because we have already started with preparation of our new conference next June. It will be on this topic. It will be organized in Tirana. So for all the details about the conference, you are very welcome to follow the information on the EASPD website and social media. Thank you again for your time, for your contribution, and I hope that this webinar make your day, and we are going with new ideas how to improve the situation and to raise awareness about the importance of family-centered early childhood intervention. Thank you again.